I would like to introduce our keynote speaker, Dr. Lucinda Canty. Dr. Canty is a certified midwife, associate professor of nursing, and director of SeedWorks Health Equity and Nursing Program at the University of Massachusetts Amherst. She received her BSN from Columbia University, her MSN from Yale University, specializing in nurse midwifery, and her Ph.D. from the University of Connecticut Go Huskies. Her research interests include the prevention of maternal mortality and severe maternal morbidity, reducing racial and ethnic health disparities in reproductive health, promoting diversity in nursing, and eliminating racism in nursing and midwifery. Without further ado, I welcome Dr. Canty.
Thank you. I'm honored to be here. And just to even look and see all the beautiful melanin in this audience, it's like a dream. Am I dreaming right now? I'm so proud to be here. And I want to talk today about kind of history. And I just want people to know that there's going to be a little trauma, but just to hang in there with me, because sometimes we have to go through the darkness to see the light. So again, there are some things that I'm going to share. And I want to talk about kind of like what my journey has been and how it has led me to really understand Black maternal health. And not only that, but also to understand who I am and what my role is supposed to be in this. And so I'm going way back. This picture in the corner is when I first became a nurse midwife. I was so innocent and fresh. I thought I could save the world, and I thought things would be easy. But it really sent me on a journey to understand, again, my purpose. And for my graduate master's thesis, I focused on Tuskegee School of Nurse Midwifery. It was the first Black school for Black nurses who want to become midwives. It was in the South, in Tuskegee, Alabama. And even then, I still really didn't even understand what history meant to me. And I realized through practice that I really didn't understand until I had a patient that just still stays in my heart. And I've had a lot of good experiences. You know, when people talk about maternal health and they say, well, they're dying because they're poor. I took care of poor women that survived and had healthy babies. When they said it's because they start prenatal care late, I had patients who started late because they were afraid of the system, and they still survived. So what people were saying wasn't making sense to me. But it was this one particular patient that I had, and again, she stays in my heart. She came, I met her at 40, she was about almost 40 weeks gestation. She was at her due date. And she only had a few appointments in the beginning and she didn't come. And because she had a congenital condition, she could only deliver by cesarean. So they really needed her to come in. They cleared my schedule. And I was so grateful because they gave me an hour to see a patient. I thought I was in heaven then, because we know that's valuable. So she came in with her partner, first pregnancy. She was she was afraid. But as we started to talk and I started to ask her about her history and her plans, it was like we were old friends. And we just started talking, did our physical, and she said to me, you know, if I had this at the beginning of my pregnancy, I would have came to every single appointment. But I didn't like how they made me feel, like I was a disease. And so, again, excellent visit. She was about to leave. I looked her in her, and she was afraid, and she still said, you know, tomorrow, I know I'm scheduled, but I'm scared. So I said to her, you're gonna be fine. You're gonna be okay. This is a routine procedure. They're gonna have your medical history. And that next morning, she was scheduled at 6 a.m. I came in about 8. Before I could even open the door, my nurse manager stopped me in the hallway. She was the most racist nurse I ever met in my life. And I met a lot of nurses. She's like in my top 5. She's up there. And she says to me, the patient died. Just like that. And she said, and she's like, oh, we did everything right. We don't know what happened. I later found out She didn't die from her congenital condition. She didn't die from the pregnancy-related issue. It was something done with her procedure. And I'll leave it there because I can't even let the words come out of my mouth. But she walked away like she just told me it was raining outside. And at that moment, I thought a lot of things. But I'm going to behave because Jenny Joseph is here. But a lot of things went through my head. But I knew that this was the beginning of the end of me being in the system. I didn't know what the system was. I couldn't name it then, but I can name it now. We have a system that is okay with Black people dying during birth. We're okay with healthy women. I've had patients healthier than me, have severe conditions. I've heard stories of ones who died. Think about Kara Johnson, the model of health, and still dying from a childbirth-related issue. So that started my journey. Again, I didn't still understand, but I was like, I have to figure out who I am so that I can know where I'm going. And I want to say that issue, that patient situation who is still in my heart, it crushed me at the moment. It erased all those good things that I did, all those patients who I still see now. And I'm scared to say some of their kids are 22 years old. Please don't do the math. But they remember me from that time. But that moment erased that. So I was like, what are my next steps going to be? And I went to nursing academia. I had to take a break. I went from one oppressive system to another oppressive system. And I'll talk about that in a minute. But it also let me see the importance of supporting our students of color. So I feel like sometimes our journeys put us on a path so that we can see and understand why we're here. And this connected me to nursing students, to students who want to go into midwifery, to students who want to become nurse practitioners. But it also helped me to see that this system is really not for us. But what I learned how to do was, how do I use the system that oppresses us to liberate us? And that's because I'm like, I can't burn down the system. I don't have privilege like that. But what can I do within it to help me to understand how to get further? And so it took me on a path to understanding my history, like truly understanding my history, and learning that nursing school, midwifery school did not prepare me to really understand, again, my history and what that meant for me as a Black female. And so I started to look at the literature, and I went beyond the things that talked about midwives not being safe. Because it's in the literature where there's all these things where they called us ignorant, untrained. And I was like, you know what? There's no way. My dad said all of us were born in the home. I didn't know what a midwife was until I was in nursing school. He was like, I was born in South Carolina. We were born in the home. You better know that. So I had to educate myself because I'm like, how did he come out? I went to my grandmother. She was like, that was natural. That was normal for us. And we felt safe. And so I was like, how do you feel safe in such a situation where you're so oppressed? But it was about community. And that's what this journey kind of set me on. So I wanted to know, first of all, where were the nurses? And I realized that the Black nurses have always been there. Even during the Middle Passage, that Black nurses were practicing nursing. And one of the most extreme situations, they were still caring for each other. And even during slavery, and the same with midwives, they were there during the Middle Passage, delivering babies, caring for each other. But then when nursing programs became institutionalized, we were told we weren't smart enough, that we couldn't do it. We've already been doing it. And I still, even though it's not in the history books, Florence Nightingale is not the beginning. The beginning started with us because we showed how we care for each other in the most difficult, challenging situations. And I still think that's practiced today. Thank you. So when I looked at my history, and we'll start with nursing, I learned of Mary Sicoli, who, even though Florence Nightingale said she couldn't study with them, she still went ahead and practiced and worked in the war. She worked as a cook during the day and worked as a nurse for free during the evenings, just to provide care to the soldiers. I learned of Harriet Tubman. How many of you knew that Harriet Tubman was a nurse? Okay, we got some people who know. Nice. But I didn't know that. I didn't know that during nursing school. And what I found out, it wasn't just putting Band-Aids on soldiers. It was about providing care, learning about herbs and applying it on wounds to stop infection. and she cared for people in her home until she died. I didn't know that history. Or Susie King Taylor, who knew how to protect herself from the smallpox so she could provide care to the soldiers. These are all things that I didn't even hear of or know about. But when I did learn, it gave me strength. And it showed me how I have a purpose, that I have the right to be here. And these are just some of the books. And at the end, there's a QR code that you can see all the historical books and articles that talk about our history from now to even some articles that are more recent so that you could see what's being done in our communities. But it showed challenges, how there was a profession that didn't want us, but we still are here, and we're still providing care to our communities. And traditional Black midwifery, I knew nothing of that in midwifery school. When I studied Tuskegee, I was still told about the negative aspects of it. And I'm like, this is not right. There were too many Black people for only 6 nurse midwives. So who was caring for these communities, and in what conditions? And I'm gonna highlight, just because of time, I'm gonna highlight only some of the midwives that I learned more stories about, but the stories are endless, and they're there. And these are, again, just some of the resources that are here, that are available, but there's more. Even if you find old medical and nursing journals, our stories are still in those pages, but they're often not highlighted. So I just want to mention just a couple of some of the midwives that I learned about. And this is also available online as well. And this is about Beatrice Cody. And when she was interviewed when she was 75 years old, and she talked about practicing midwifery at the age of 18. So even when you hear that term, granny midwives were of all ages, and it was a calling. And they weren't trained in an institution, but they did receive a formal training. Because our experiences have value. Our experiences really give us insight to understand what's happening in the world. And they learned from African midwives, and it was just passed down from generation to generation. And we often hear stories, again, about untrained, unsafe, that they put women in harm's way. And I'm like, that can't be our story. And when I went deeper, I found community. I found people who, this midwife, how she had a family that she delivered, and the father had to borrow $26 from his employer to pay for the delivery. She took the money and bought food for the family. And she only, in her years of experience, and again, she practiced way up into the 1970s. And she said she only had 2 complicated cases during that whole time, some twins and someone who had toxemia. And that was it of all her years of practicing, because they also were aware and knew how to practice really a science. And we often don't want to associate science with our history, but it's very vital, again, to who we are. And so, again, I just heard more stories about that. And this is Miss Sarah Penning. I learned of her story through Miss Frankie Manning, who's in her 80s. She's a nurse in Washington State. And she told me about how everyone called her aunt, her great aunt, Miss Penning. They called her grandmother by her first name, but everyone always addressed, because they had so much respect, they called her Miss Sarah Penning. And she didn't understand it at the time, but she understood it as she became older. She said that my aunt, there was something that everybody relied on her. She would help anyone. And she told me a story of how her brother was born prematurely, and it was 40 minutes to get to the hospital, and sometimes in those hospitals they were segregated, so their baby could be on a floor where there was polio or other infectious diseases. So her aunt kept the babies home with their moms. And she said, I couldn't believe it. She warmed up bricks and put my brother on bricks. And she said, my brother lived well. He survived. All she had to do was keep him warm. And she was like, I was amazed. How does she know how to do that? And she said, that's just one of the stories that she shared with me, but there was so much more. But one of the things that really stood out whenever I talk about traditional midwifery is the sense of community. How there were people who brought wood, how people watched the children, how there were people who, they already knew the circumstances of what was happening in the community, and they were non-judgmental. So if somebody was a single mom, they would come and say, we're gonna help her. They would bring food. They would even allow that person to stay in their home. So there was that sense of community. And she even talked about fathers washing clothes because they had to get out of the way, but they were still present. But anyways, it was a community effort. and that birth was celebrated. It wasn't seen as a disease or a pathology. And I think that's really the reason why we survived. Because when you look at the statistics that we hear today, during this time, now just imagine when segregation, racial violence, sexual violence, that there were still racial disparities. And I have statistics going back to 1932, but it was always like a 2-to-1. So black women were twice as likely to die compared to white women. And now we're at 3, some people say, they say 2.5, but I think we're 3 or 4. You go to some parts of this country, it's unimaginable. And those statistics are still kind of hidden. But you can find them if you look, because if you want to know what's really happening in our communities, you can look and see those numbers. And knowing that 80% are preventable is I can't even describe how that feels. But just in the black community, how pregnancy and childbirth, even during slavery, women were empowered, midwives were empowered, and they empowered women regardless of all the things that were happening around them. And that it was like a temporary kind of freedom that they had. They didn't know what was going to happen, but they knew at that moment that they were in control and they had some power. And they wanted to make sure that that baby was safely born and that mother was safe. So if you could imagine those conditions. I talked to midwives who didn't have electricity or hot water, and the babies and the moms survived. A colleague of mine, Teresa Friedman, she talked to her grandmother, who was a midwife. And she said how when she was in her 80s, she developed dementia. But she always would say, there was one thing she always remembered. I delivered 87 babies, I didn't lose anyone. That was the only thing that she remembered till she died. So nursing and midwifery is a complicated history. And I wanted to know why, and this is from the bulletin from the Tuskegee School of Nurse Midwifery, but I wanted to know why, how nursing was introduced. And nursing was introduced, there were no statistics, nothing that showed that nurses or having a nurse and midwifery placed you in a better position. And there's still, even to this day, it's still being debated. So it's still something that's challenging that really needs to be researched and understood. And I live in 2 worlds. I live in nursing and I live in midwifery. And I'll talk about that. But really at that time, it was really about control. One is that doctors train nurses in obstetrics. So you see how it went south right there. And also too, though, at the time, nursing schools, because of segregation, nursing schools were not accepting black people. And there were laws that supported that. And the same in the North. We always say things happen in the South, but in the North, they had quotas. Where Mary Mahoney went to school, they only accepted 1 black nurse and 1 Jewish nurse every year. That was it. So you see that already we have barriers that try to prevent us from practicing midwifery. And even to this day, look at those nurses who are working in maternal health. How many of them are nurses of color? Go to any of these major organizations, these major hospitals, and you still see that there's a gatekeeping. And again, when you look at our history, you hear the same things, just said a different way. So we really have to look into that. But I just want to give just gratitude to the Tuskegee nurse midwives, because they knew how to work in the community, they understood the social conditions, and they work with traditional midwives with respect and dignity. There's no way that they would have even been successful if they did not work with the members already in the community doing the work. And I just want you to remember that as we go to the end. And I just want to show Maud Callan. She's a 1943 graduate. And this program was only in existence for 5 years and graduated 31 nurse midwives. But I just want you to see what Maud Callan did to get to families. And this is the same for traditional midwives and also nurses working in the community. Mary Mahoney was also, and I didn't realize this, but she was in the hospital initially. She was trained in the hospital, but she felt she could be better, more effective working in the community. So she realized even at that time the importance of it. And I just want to share for myself, this was like life-changing for me to learn my history. Because again, I live in nursing and I live in midwifery, so I live in 2 worlds. And I love both worlds. Even though sometimes I complain, I still love both worlds. But one thing I realized looking at my history, more important than that, is that I'm a Black woman first. So when I show up in the space, I should have respect, regardless of how I show up. And that's the same for the women that we care for, our colleagues that we work with. As Black women, our history shows us that we have a right to be here. And we know what to do, and we know how to handle our own communities. So for me, it was just important that I realized in learning my history how much trauma I experienced because of racism, how many opportunities lost, how many things I could have stood up for my patients, but because you internalize that, it puts you in a position where you can't do what you need to do for those you care for. And it was at this moment that I realized I'm gonna be me. I'm gonna authentically be me. Either people like it or they don't. But my purpose is beyond me. It's to keep Black women safe, to keep Black birthing people safe. And right now, whatever I have to do that, I'm gonna do it. It's like we are, sorry. It's because we know, thank you, we know as Black women, when we show up in a space, we always have to make excuses as to why we're there. Nobody else has to do that. We always have to prove, we have to work twice as hard. It has an impact on us physically and mentally. And people know that and they still put more on us. So for me, it's realizing that I'm all that I need to do what needs to be done. We already have in our communities what we need to survive. We just need people to stop creating barriers so that we can do what we have to do. And so for me, I also just want to say that I feel like my education conditioned me to think that things are okay the way they are. But it wasn't until I did my own research where I said, you know, I'm going to talk to Black women. I'm going to go in non-judgmental, because I can't say every Black woman's experience. And what I learned was that, and I have to admit, when I was a student, a Ph.D. student, I said, I'm going to go in, I'm going to do educational classes, I'm going to get people in for prenatal care early, and that's going to be it. But what I learned more from just talking to women and not saying anything, just keeping my mouth shut, and just letting them talk about their experiences, how knowledge, health information, if we don't have it, it places us at risk. How our relationship with the healthcare provider places us at risk. And some of us know that when you go in, even at the front desk, sometimes you're not even welcomed, and it's like it starts there. And then you're wondering, who is the provider going to come in the room and see me? What kind of mood are they in? But that has a significant impact on the experience. And we know that race matters. Race prevents women from getting even the standards of care. Someone with a headache, if they're not having their blood pressure checked, that's a problem. Even if a Black woman says, I don't feel well, or a Black birthing person says, I don't feel right, something's wrong, if they're not assessed, they're not even getting the standards of care. And when things go south, it's always the patient that gets blamed. It's never the provider. So for me, I'm just saying as nurse midwives, as nurses, we have to stand up because we're a significant part of this. If we don't stand up for our patients, who is going to stand up for them? And this is the uncertainty. And the thing that really scares me now is I hear young Black women saying, or anyone thinking about having a baby, is I'm scared, I'm afraid. There was a time when I started practicing, we used to worry about pain. I would even have men come out of the woodwork saying, I'm worried about the pain. And I'm like, but you know, that was our greatest fear, and we knew that there were things we could do to get through that. But the uncertainty, when that question came up, I didn't even know what to say at first. Because I looked the woman in her eyes and said, you're gonna be okay, and she wasn't. So how can I say that and really feel 100% confident? And again, that's where my history, learning my history came in. And I want to know, like, how can that work to address what's happening now? And for me, it's really going back to our roots. And it starts with listening to Black women. I'm just thinking back in history, when you look at the midwives, they were trusted and valued and respected, that people went to them with any issue. Anyone went to them, whether they were pregnant or not, whether they wanted to get pregnant or they didn't want to get pregnant, or they had other ailments. They took care of the entire community. but they were trusted. And I feel like sometimes I'm in spaces, even in Black maternal health, I'm in spaces where people act like I don't know what I'm talking about, or they don't want to listen, or they know more than me. I have people who don't even talk to Black people, and they know more than me. And they tell me how I should show up. But I'm not playing that game anymore. There's a lot of things, thank you. And you're going to hear from some just amazing speakers today. And you'll hear about things that are happening and that they're doing in their communities already, and the impact that they're already having. And we have to, that's the first thing, is like looking towards our community to address the issue. And just want to say that when it comes to Black maternal health, we no longer want to know that there's a problem. We already know there's a problem. This goes back hundreds of years. So now it's time for action. And just recognizing that Black women, Black birthing people know the issues and know the solutions. We need a space where we could be our authentic selves. It's draining when you have to pretend. You have to act like a certain way to get what you need to care for your communities. So we have to just have spaces where we could be our authentic selves and trust each other, and to focus on prevention and address the physical and mental well-being. And I say that for those of us who also care in these communities. We have to take care of ourselves as well. And we have to, when I looked also at our history, there was always about this protection, that in your community you were protected. We knew the horrors that were happening outside, but here we're going to keep you safe. So we have to go back to protecting each other and just non-judgmental support. Seeing women where they are, regardless of how they come. It's like, I'm not sure if this is a Black thing, but it's like when I show up, everybody knows me. They think they know my history. They know where I've been and what I've done. And some of them have never spoke to me. So there's always judgment, like we just can't be free. And we have to change that. And that's one thing that was important in our communities, is however you showed up, we're gonna be there for you, and we're gonna support you. And just to celebrate that we already have what we need in our communities. So I'm going to end with a poem, and I just wanted you to see this QR code. So these are all the references and several articles. And even looking back in the American Journal of Nursing, I found articles written by Black women in like the early 1900s. And they're just talking about our experiences and what we do, just so that you could see that we truly, truly exist. So I'm going to just end with a quick poem. And this is a poem that I wrote in regards to history. It's entitled, When I Think of Myself. When I think of myself, I think of quiet lullabies, moving stories that uncover hidden truths, secrets of resilience buried within lies. When the realities are exposed, darkness turns to light, highlighting experiences no longer kept silent, speaking unapologetically, dismantling trauma, eradicating hopelessness. No fear of failure, no pain of success, being seen when others turn their backs, unexpected support, freedom of imagination, blossoming into something greater, something bigger than myself. Accepting something that was always there, love. Love is always present. Loving myself, loving my people unconditionally. Okay, thank you.
Thank you, Dr. Canty. I love that. Loving myself, loving my people unconditionally. So before I move on, I just wanted to ask you guys to please follow us. We have a few handles. We have at BMM Tufts. We have the Center for Black Maternal Health and Reproductive Justice at Tufts. It's CBMHRJ_Tufts. We also have our hashtag BMHC2023 and our hashtag BMM Tufts. So please consider following and posting about this event. So next, I'd like to welcome Tiffany to the stage, who will be introducing the next part of our session.